best nurses, the best medical care on average in the world. But there's a lot that we don't know that could work, that we need to learn from other places too. The only way to be, I think, sure that we should pay for it is to do the research. And that's what I will certainly, to do everything I can to support. Oh my goodness, so many hands. Yes, right there.
Just yell out.
Yell out and I'll repeat it.
Okay.
Wait, he's getting closer. He's very agile. Under the tape.
My name is Tina Whitfer, and I am a dental hygiene student here at DMACC. So my question for you regarding your universal health care is, since there are so many evidence-based correlations between how will that tie into your American Health Choices plan?
Well, I want to cover dental care. And in the congressional plan, which I open up to everybody, there are more than 250 plan choices. Most of them, practically all of them, I think, cover mental health as well. Two things that you have a hard time finding in insurance policies outside. I'm really glad you said this, and thank you for being a dental hygienist, because one of the things we are finding out is all of the connections between dental problems and heart disease, between dental problems and other systemic conditions. So if we don't cover dental care, you're going to miss a lot of the problems that will then get very expensive. And to go back to the doctor's point, you know, I worked for years with the Children's Defense Fund. And one of the things we do is collect information to try to influence decision makers. And for months, I talked about the story of a young boy, 12 years old, living in Maryland. His mother worked, but didn't make enough money to have insurance, made a little too much money to be on Medicaid. Her son had a toothache. She couldn't find a dentist to take him because they didn't have any money for a dentist. They called every dentist they could get, and some were very sympathetic, but they said, well, we already have our full complement of charity patients. We can't take anybody else. Turned out he had an abscess. The abscess burst. So he ends up in Johns Hopkins Hospital. They try to save him. He dies. The hospital incurred $300,000 worth of medical care trying to save him because his mother couldn't get a $60, $70, $80 amount to pay for a dental visit. So that's the kind of story that underscores the unfairness of the system, but also the importance of covering dental care. And I intend to do everything I can to make that happen. Let's see, I know that I saw a hand. Yes, sir, right there.
It's an honor to talk to you, but I have to admit I don't actually support you, but...
Okay, I'm glad you're here.
You say that the healthcare system isn't working the way it should. Well, then my question is, why would we want to add on to it before? Shouldn't we want to fix it first? Fix the condemned house, so to speak, before we add a guest house? Like Social Security and Medicare, the baby boomer retirement is not going so well.
Well, see, I think everything that we need to fix is pretty evident. I don't think it's that complicated. I think the big problem with our healthcare system are not our doctors, not our nurses, not our hospitals. It's our health insurance companies and the way we pay for healthcare. That is dysfunctional. And so what we have to do is keep what works in our system, but change what doesn't work. And I know that it's somewhat daunting to think about changing healthcare, because even though a lot of it isn't working for many people, it's kind of familiar. And you know what you can expect. And you know, people get used to waiting in emergency rooms for hours, or seeing their premiums go up 10, 20, 30%. But we're reaching a tipping point where that's no longer sustainable, so we have to fix it. Just like we have to meet the long-term challenges of Social Security, but we have a lot more time to do that than we do to fix Medicare and fix health care, because those are really crises, in my opinion. So I appreciate your coming by to be here today. Yes? Where do I stand on the use of medicinal marijuana and the research behind it? I think that we should do research behind it and figure out, again, to get back to evidence-based medicine, what is it that might be in it that actually helps people who are suffering, and then figure out how to make that legal. So I think we should look into that. But I think it is, you know, you've got to be careful about how you do it. That's why we need good research. Yes?
To happen around the world as well. And I'm talking specifically about the TB epidemic, which kills 2 million people every year.
First of all, I'm so sorry about your mother. And she must have been very proud of you. And I really appreciate your concern about TB, because it's not often raised in settings in our country because we rarely see it anymore. But you're 100% right. And what Americans have to face up to is we need to deal with TB around the world, because what's happening is that we're getting drug-resistant strains of TB. And given how mobile people are in the world today, TB viruses don't respect boundaries. And these diseases, it's not just TB, but others, will be here in Iowa. So we've got to address TB and do everything we can to implement a regimen of treatment that will work. And the United States has to be a leader. I'm not familiar with the exact bill, but I'll look at it. But I have supported increased funding for TB, for malaria, for HIV/AIDS, and also for orphan diseases that together take a lot of lives that we don't, drug companies aren't interested in because, maybe 50,000 poor people in some part of Africa or Asia are afflicted by it, and they don't think that there's any money in it. So some very courageous and far-sighted people are creating research pools to be able to look at this. And I want to put more federal dollars into it. So yes, I will do everything I can to combat TB around the world. Yes, way back there.
Senator Clinton, I have a question about prevention. Right now, most of our federal dollars that support research in medical fields go towards treatment and cure. And a very small portion of it goes towards programs that might prevent diseases. I'm thinking about the diabetes epidemic that we have in this country, the obesity epidemic. I think the food pyramid is upside down. And I'd like your opinion about that and how you might change the priorities.
I have talked about prevention, particularly as it relates to diabetes and obesity, for the entire time of this campaign, because we are not addressing the increase in chronic conditions that is occurring because of our eating habits, our lack of exercise, our failure to pay for prevention that we know can work. So it's a very important and serious issue to me. So here are 5 things I want to do. Number 1, under my health care plan, all insurance companies will be required to pay for prevention. Right now, they escape paying for prevention. And as the doctor who specializes in diabetes knows, it's kind of similar to what we were talking about with the dental hygienist. That if you're a diabetic, you should get your feet checked every couple of months. You should go to a podiatrist. You should make sure they're healthy. A lot of insurance companies won't pay for that. I was in New Hampshire a few days ago, and I was having a roundtable discussion about healthcare, and one of the people at the table was a diabetic, and she said she's really lucky because her insurance policy does pay for it, but she knows other diabetics that they don't. Well, the sad fact is, if you have to have your foot amputated, they'll pay for that. So it makes no sense, not economically, not morally, in no way does it make sense. So we're going to have every insurance company have to pay for prevention. Number 2, to go back to the point that the lady over there asked me, there are a lot of prevention protocols that we can't get accepted by conventional medicine or by the payers of bills, whether it's Medicare or insurance companies. And we need to do more research to be able to demonstrate unequivocally that changing your diet, like you say, reversing the food pyramid. Dean Ornish has done a lot of research on this and has been a real leader in proving that you can eliminate blockage in arteries through very intense changes in diets. He's now proving it with some cancers, particularly prostate cancer. So we've got to get accepted into conventional thinking how your body can respond to changes in behavior.